Hi, I'm Dr. Paul Potter. I'm a chiropractor here in Coronado. I've been practicing here since 1996.
Hi, I'm here interviewing Dr. Paula Potter, who's a chiropractor here in Coronado.
Hi.
All right, what education did you need? How much school did you need to become a chiropractor?
To be a chiropractor, you have to have all your pre-medical education background. So for me, it's required 2 years of pre-med studies like biology, chemistry, physics, and biochem, and things of that nature. So basically everything that you need for pre-med, and currently 3 years are required just to get into the chiropractic school. So most people have a bachelor's degree going into the chiropractic schools.
And how many years are you in the chiropractic school?
4 years is the basic requirements. Some schools are 5, and then once you graduate, you get your doctorate, and then you sit for boards. But some people specialize, like in neurology, which may be another 2 or 3 years past that point.
Wow. Did you ever take a sports medicine class?
Sports med classes were throughout. There was 2 or 3 classes in chiropractic schools that had sports med specifically. And just as a caveat, most chiropractors, a lot of chiropractors who are on the pro sports teams, like the Chargers have chiropractors, Padres have chiropractors. Actually, you can go into horse specialties like the Del Mar racetracks, and they'll have chiropractors actually for the thoroughbred racehorses.
All right. Did you enjoy the sports medicine classes? Were they interesting to you?
Very enjoyable. They were, from what I recall, it ran the gamut from people from just basic high school sports to professional sports and what the usual injuries would be and how to correct them.
All right. And did you do any internships or any extra experience outside of chiropractor school and college?
I did a year's worth of externships after I graduated at 3 offices. I did not do an internship for like sports med though.
Okay, that's fine. And what sparked your interest in the medical field and chiropractic?
Well, basically, I was in the Navy at the time and trying to figure out what I wanted to do. And the thing that most impressed me about the chiropractic field was that it helped people, and there was immediate gratification from what the procedures we do in chiropractic. And it was natural, so there was no side effects, and it was very helpful for people. So that's the main reason why I got into chiropractic.
Awesome. And how do you like what are your hours and your schedule like as a chiropractor?
I typically work longer than most chiropractors I know, because I usually have hours for 6 days a week here in Coronado. But typically a chiropractor will work about 3.5, 4 days a week, and they'll typically run about 30 or 40 hours of patient time.
So is it okay for anyone to see a chiropractor, and are there some people who are more receptive to the treatment?
You know, I have a general practice, so most people come see me are from early teenagers all the way up to very old senior citizens, and I do have occasional babies that come in. I have a couple dogs that show up here, but for the most part it runs the gamut of whoever has a spine that can be worked on.
Okay. Now if it's okay, can you show us some equipment that you use in your everyday?
Yeah, well, the typical is just the chiropractic adjusting table. So this is just a stationary table, and I want to show you a hydraulic table that just basically it's called a high-low table. It's pretty standard in the chiropractic profession. It's kind of a fancy table that goes up and down. Helps with people when they're not ambulating well, who can't lift themselves up. That basically these are the basic tools of a chiropractor. And then I have other things like an ultrasound machine, which in physical therapy it's used quite extensively. And sports med, it's my preferred choice of physical therapy modality. I have an adjusting instrument that basically moves the joints without having to move the patients too much. So people who are osteoporotic or actually people who are less mobile prefer this. I have soft tissue instruments such as this one that looks kind of like a jigsaw, but it moves the joints and the muscles about 1,600 times a minute. And it dehydrates the nerves, which is kind of a fancy way of fatigues the nerves so that the muscles can relax. And then I have something that's used readily in chiropractic offices. It looks like a dental instrument to like pulverize teeth, but it's called an activator. And so basically it moves the joints without moving the body. So a lot of women prefer this. A lot of people who don't like the normal chiropractic adjustments prefer this to adjust the joints. So that's typical of an instrument.
And what do you most and least enjoy about your job?
What I least enjoy about my job is the same thing as I most enjoyed about my job. It's the interaction with people. It's a very intimate setting, but at the same time, there's got to be a trust level that's between patient and doctor. And so a lot of rapport building is happening at the whole time between the intake all the way through until I discharge them. The least likely portion of my practice would be the paperwork for patient visits. That would probably be for most doctors.
Now, what types of injuries do you see most often in here?
Well, chiropractors are known for neuromuscular conditions, so neck sprains, back strains, ski season's here. So a lot of people will leave for the weekend to go skiing. It's great for my business because afterwards they'll come back with all kinds of aches and pains in their lower extremities and upper extremities. So shoulder problems, wrist, elbow injuries, knees, hips.
So it is
ankles.
possible to adjust knees and extremities as well
Absolutely.
as backs?
Yeah.
Alright.
Anything with the joint that can move, a chiropractor can influence.
Okay. And what sports bring you the most patients? You said skiing. Are there any others?
Well, Cornell is big
especially?
on water polo, so I get a lot of water polo people here. Softball, football, and baseball.
And do you ever utilize your profession outside of your actual job in the
Sure.
office?
You can be consulted at health spas. Is that what you mean by that?
Yeah.
Okay. There's I don't particularly, but right now there's over 100 different hospitals that utilize chiropractic services. Outside the practice, high school sports places, a lot of chiropractors are their high school sports doctors.
Okay.
Sports management clinics like Oasis has chiropractors on staff. The Texas Back Institute, which is highly regarded, has chiropractors on staff. So it's utilized besides private practice, and they are used in hospital settings. The VA and the military has them. The sports teams have them, and actually veterinary medicine and chiropractic are melded together for animals. So.
Okay. All right. And what are the possible benefits and risks of a chiropractic adjustment?
There's many risks involved when I do procedures. They can run as far as death and stroke, all the way down to just a sprain, strain, fractures. Those are things that have occurred in chiropractic practices before.
If you would adjust
Yes, because I'm actually physically, or if the patient is set up like an osteoporotic patient, or somebody already has a very unstable spine. So you have to rule those out before you start adjusting people. And the benefits are far-ranging. As you can see on this chart, that the chiropractor works with the whole spine and all the nerves associated, which basically controls everything you do in your body. So people can come in for back pain, but then they can also find that they have more energy, less problems with their, how can I say this, digestive tract. And these are separate from the actual reason they came in.
So what is the ultimate goal of a chiropractic adjustment? What is your...
The ultimate goal for a chiropractor, there's only one goal, and that's to remove interference to the nervous system. And they call the term subluxation, which is basically a spine misalignment that can put pressure on the nerves. And ultimately, if I correct those and detect those and remove them, then your body should run as best it can.